So I talk about the vaccines, I talk about immunology in this book. And really fundamentally, the key to stay safe is to get an effective vaccine. And then you have immunity against the virus. Yes, you can get immunity from getting naturally infected often, but that can be really dangerous, especially if you're in a vulnerable group. And so vaccines were always going to be the way that we accelerated progress in a pandemic. And this was particularly amazing that we got vaccines so quickly in the setting of 2020, as opposed to the 1918 influenza pandemic, where we didn't have the technology to develop vaccines quickly against influenza. So vaccines were an incredibly important part of the COVID response. Vaccines will always be a part of a pathogen response. But what we did during this pandemic is that we kind of used a one size fit all instead of being more incisive and tailored and chiseled to our approach. So we said, in the United States, let's boost everyone from 6 months onwards, whereas other countries were saying, let's boost vulnerable people, let's boost older people, people have comorbidities. So again, everyone could see what they were doing in Europe compared to here, and pushing boosters for everyone as opposed to high risk individuals didn't seem to make sense. There was a very large UK based study published in The Lancet that showed out of 30 million people who got the vaccine, 2 doses worked really well for a majority of people, but the booster was really helpful for older people, those on immunosuppressants, and those with comorbidities. So you want to tailor your boosting appropriately for more vulnerable groups, and especially ongoing boosting. You want to save the antivirals for like Paxlovid for those who really need it. And you also, by closing all of society, as opposed to saying, well, I know how important school is for your kids, we're going to let that be open. Maybe the bars and restaurants are going to close for longer. Medical care is really important. But by closing everything in a blunt way, that also led to a decrease in trust in public health. So where are we right now? Unfortunately, we're in a position where there is a lot of anti-vaccine sentiment. We are having mumps, diphtheria, and measles outbreaks right now in South Africa. We had a large measles outbreak in Zimbabwe in the summer of 2022. In November of 2022, we had a measles outbreak in a daycare in Ohio, all among unvaccinated children. And we are seeing decreasing rates of vaccine for example, vaccination against polio. So if we're in this place where people don't trust the vaccines because they thought the COVID response was not moderate, was not reasonable, was not holistic, we have to bring back our faith in vaccines, because vaccines is really the mainstay of infectious disease control. Ever since we got vaccines, I mean, going back to the days of Jenner with smallpox, and Jenner took a related vaccine called cowpox, and he gave a little bit of cowpox to people, and they were saved from these terrible effects of smallpox. Vaccination is really the mainstay of how we keep people safe from not all infections, but severe disease, which is what people really are very scared of. And so how to build back that trust? I think admit where we went wrong and say it. So, for example, there's a concept in medicine called modifiable and unmodifiable risk factors for disease. For example, for heart disease, smoking may be modifiable if you can change that, and unmodifiable is that you have a family history of heart disease. So what can public health do in a modifiable way to change this anti-vaccine percolation of sentiment across the world? They can say, I'm sorry this was a hard time. I'm sorry that schools were closed along political lines. I'm sorry that the messaging was mixed and confusing and not clear. I'm sorry that it wasn't as transparent as you'd hoped. Even if it wasn't their fault, just say, I'm sorry this was a hard time, but vaccines work, and let me explain to you why. And then go back to the education, the harm reduction, not coercive, but harm reduction and education on why vaccines are so important for childhood health and for ongoing health into adulthood.